This health worker, whose identity will not be revealed, is one of the country's COVID-19 frontline workers who offered vital care during the pandemic when the health center where this health worker is employed received its first COVID-19 patient. Fear and anxiety gripped the staff.
When we received a younger man who was coming from Dubai, a businessman, and when they tested him, the following day, results turned positive.
But as the pandemic took root and the cases increased, the health workers were divided into shifts to cater for the high demand for medical treatment.
We used to work in shifts of 2 days, that is day and night shifts. And each day had at least medical officers and nurses, hygienists, and clinical officer. Each duty had. At the beginning, we had fear. We were scared, like we enter, you think you are coming out with what? COVID. But as time went on, we got used, we became firm, and we handled those patients like another patient.
The ministry also recruited more health workers.
We had permanent health workers. Those are the ones who were working in government already and on the salary scale of the government, and they were getting their salary. We had contract health workers, because like Ministry of Health advertised, so that was the second category, and then we also had some volunteers.
By this time, the public service had agreed that all health workers involved in the COVID-19 fight would be paid 1.5 million shillings per month in allowances.
Even of which that 1.5, people were getting less money than that with no proper explanation. So other people got demoralized.
However, as the COVID-19 cases reduced, the payments also started slowing down.
We stopped getting our risk allowances in August. Okay, we last got the one for August 2021, but with effect from October 2021 up to March, we have not gotten any money. When they read the budget, we saw on the TV that they had released 20 billion for the health workers who worked in COVID-19, so like we became happy. But up to date, we have never received any coin.
Additionally, the contracts of the temporary and volunteer staff were cancelled. It is the state of affairs that has prevented many health workers from responding to the health ministry's call to join the fight against Ebola.
Morale, because like we had risked for the past 7 months without any payment. And as you risk, you leave your family, you leave everything and forget about your other businesses. You get it? Then you work, hoping that maybe at the end of the month, you will earn something, then you don't get.
The health worker now wants the health ministry to reconsider its treatment of members of the health fraternity.
My appeal to them is to consider the last people down here, because we face a lot. We are the ones who are dying in these pandemics, because like even we lost a health worker in that pandemic, and so many have died in this Ebola.
When approached on this matter, the Ministry of Health noted that it is indeed aware of the non-payments and is waiting upon the Ministry of Finance to provide the required money. This call comes at a time when health workers who have been battling the Ebola outbreak in Mubende district are also raising similar complaints of non-payments. Joyce Nakato, NTV Tonight.